Hi, Dr. Wadsworth here at Uintah Spinal Health. I'm going to share with you how we evaluate the ankle for a sprained ankle, how to treat it, and how we can really focus on the ankle to prevent any injuries that go up the chain, your knee, hip, or lower back. We want to catch it early if you have any sprained ankles in your kids from football, basketball, running. If we can treat it right in your youth, then we can keep the mobility in your ankle to prevent injuries, especially the lower back. The ankle is a mobile joint. That's what we want to focus on. We want to keep it mobile. If it starts to lose its mobility or its ability to bend in all directions, then you start to compensate for it. That's where you start to see ankle or knee injuries and lower back injuries that come up later on in life. So if you have an ankle sprain, that's typically most commonly a lateral ankle sprain. Is when you're going to step on a foot or roll an ankle. You're going to roll your foot this way. You're going to have pain probably along this outside part of the ankle, sometimes down into the foot. Some swelling or discoloration can come up. But what we're going to do to evaluate it first, we're going to test the integrity of the ligament. Stabilize here. Let's go here. Just apply pressure here to see if this moves excessively or not. Okay, we're going to come forwards. A little bit here. Aaron sprained his ankle quite a bit. There's some give, but not terrible. So to treat the ankle, before we treat it, we're going to test the muscles. So I'm going to push into my foot. Okay. I'm going to pull up. And again, we're testing see if there's any muscle weakness or pain. You're going to hold your foot out like so. Hold your foot in this position. Don't let me turn. Good. Down. Hold your foot here. Good. Down. Also test the toe. So big toe push down. Big toe push up. Little toes push up. Little toes push down. Okay. Relax. Okay. We're going to test that. Then we're going to just test the palpation and the range of motion within the joint itself. And test the palpation and tenderness of this muscle up here. A lot of times this muscle gets tight when we sprain it and this muscle gets pulled. We're going to test anything up here and just feel what we find. A little tightness here. So we find this, we have swelling. The big part is we want to try to control the swelling. Swelling can be a good thing. Sometimes it gets a little too much, so we're going to control that. We can do that with my tool here. We have some instrument-assisted soft tissue work or scraping. Okay. Some scraping like this. We can also do some cupping as well as dry needling to the areas of the muscles. I probably do dry needling up here into this muscle to help reduce the trigger points in the muscle up there, reduce the tension, and reduce the pain. We can do dry needling into the ankle itself. And then when we can, we'll adjust the ankle when it's ready for it. The ankle and the foot itself, the foot, arch of the foot. And then we'll tape to support it. More support to help with the swelling, help reduce the pain. Place some tape, we'll cut it off. Tape up this way, and whatever we may feel like the joint, the ankle itself needs to help with the healing process of it. So definitely focus on the ankle, and then also look up the lower back, see if the lower back's compensated at all, and adjust the back or treat the back as needed, whatever we find there. And then we'll go through some exercises. A big part of the ankle itself, bend your knee, is we want to keep dorsiflexion, which is your ability to bend your foot up. Okay, and I'll show you in a little bit of how to test that and what exercises we want to do to regain that range of motion. We definitely want to regain this range of motion. If this dorsiflexion loses its range of motion, that range, then that's where we start to feel some compensation in the knee, hip, lower back, and starts to go up the chain. You start to compensate that way without this ability to bend this way. Alright, so here's a way to test the ankle dorsiflexion and your mobility to bend your ankle in this direction, and then some exercises how to help with that after we get treatment in, and what you can do at home. So what you can do, you get to a wall, or get a brush or a broom, but you can get to a wall and pretend this is a wall. You're going to get your toe, your fist width away from the wall. So go ahead and show me your fist. From there, we're going to place here. So I'm going to pretend this is a wall, or just get a pull. You can raise your arm up. And what you're going to do is you're going to bring your knee to the wall as far as you can, with keeping your heel on the ground. So don't lift your heel up. Go as far as you can this way. So go move forward. So Aaron can get here. His ankle is staying here, so he has good ankle dorsiflexion. The other thing they want to do, a lot of people will come down and they'll get to about here when they start to raise the ankle. And that's where we want to really work on the ankle dorsiflexion and treat that and mobilize the ankle that way. What we want to make sure is, flip around this way. When you bend forwards, you want to make sure that, pretend they're your extension of your femur. You're going to bend forwards and make sure your knee is pointing over your middle toes and back, and not diving forward. So show them diving forwards. We don't want to see this. That's just going around the ankle issue that we have. We want to see how far you can go with your knee pointing forwards or a little bit outside. An exercise to do is going to be this movement, but you can grab an extra weight. A couple of things. You're going to do this same movement, weight on your ankle, and just mobilize, rock back and forth in that proper form. The extra weight can just add weight to the ankle. You can mobilize it that way. You can also get a band. I'm going to grab this band here. Oopsie. Grab an exercise band. You can lock it in down below at a door or a chair to pull your ankle down, and then do the same exercise. Pull down, rock forwards. Or just use your foot, your hand, and just hold here. Just some additional things to help mobilize the ankle itself. Here's another exercise. Here's another exercise that we work on to help mobilize the ankle and gain stability around that mobility that we've gained. There's a star pattern. We're going to work on his left ankle. He's going to step in the star with his left ankle. He's going to hold a weight that's stabilizing. You're going to hold it up, hold this by the horns, hold up to his chest. And what he's going to do, there's a star here on the ground. With his right foot, he's going to reach out, bending into his left ankle, and tap beyond the tape each side. Go out forwards, sideways, diagonal, sideways, back. So we'll do this several times, working into the ankle, bending into the ankle, and bending this knee slightly. And make sure that knee bends over the middle toes and not going inwards, not diving inwards or too far outwards. And we'll repeat this each side this way. And when he's advanced, we can get more stretching across his body to the other side. But again, this is a more advanced one of many ankle rehabs that we do to help with ankle sprains, shin splints, helps strengthen the lower body, lower leg, and progress that way.